Hello. Pregnant women are at an increased risk of developing a blood clot because of changes in their blood during pregnancy. You are at risk throughout your pregnancy and for 6 weeks after giving birth. This video will discuss how you can reduce your risk of developing a blood clot. There are two types of blood clot: deep vein thrombosis or DVT and pulmonary embolism or PE. A DVT is when a blood clot forms in a vein, usually in your leg. The clot can get stuck and can make the leg red, swollen and painful. In a small number of people, part of the clot breaks off and travels up to the lungs. This is a PE. A PE can reduce the amount of oxygen being delivered to the body. If the clot is large enough, it can result in death. In addition to being pregnant, your risk of a clot is further increased if you are over 35 years old, overweight, a smoker, pregnant with a multiple pregnancy, are dehydrated, especially from severe morning sickness, have pre-eclampsia, have a long labour or a caesarean delivery, or have had a previous blood clot or family history of blood clots. Doctors and midwives will assess your risk during and after pregnancy. If you do not think you have been assessed, speak to your midwife or doctor. Preventing blood clots is vital to a safe pregnancy, so don't be afraid to ask. Simple measures that you can take are drinking plenty of fluids and remaining as mobile as possible, both before and shortly after giving birth. A good exercise is to lie on your back or sit, whilst bending and straightening your ankles quickly. By keeping your knees straight, you will help to stretch the backs of your legs. Depending on your risks, doctors may also advise you to wear anti-embolism stockings. These help circulate blood through your legs. Have injections of low molecular weight heparin, a medicine which helps to prevent blood clots. Low molecular weight heparin injections are safe to use during pregnancy and when breastfeeding. Be aware that it is common to develop some small bruising around the injection site, but this usually fades quickly. Fewer than 2 women in 100 will have an allergic reaction to the injection. You should inform your doctor if you notice a rash after injecting. Unfortunately, some women still go on to develop a blood clot before or shortly after pregnancy. You need to be able to recognise the signs of a clot so that you can seek help quickly. Signs of a DVT include cramps, aching, warmth, redness or swelling in your legs, and pain on pointing your toes up towards the ceiling. Remember, these symptoms usually only affect one leg. Signs of a PE include shortness of breath, chest pain, which is often worse when you breathe in, palpitations, which is when you feel your heart racing in your chest, dizziness or coughing up blood. If you notice any of these things, you should contact your GP or local emergency department straight away. If you have any questions or concerns about blood clots, please ask your doctor or midwife.